We bring people over with tremendous experience. I mean, the healthcare administration teaching team that we've had the past couple of trips have been fabulous. They're the people that I would look to for leadership here. So they have real skills in our setting, and to be able to take it to that setting has been great. The last trip I was on last November, we did a course in the capital city on pediatric emergency medicine topics. It's the same course that I've taught here and that I've taught in places like Taiwan and Kuwait. So it was wonderful for them to feel that they were getting the same training that somebody in Calgary or a place like Kuwait, which has many more resources than they do. They were getting that same topics, and of course you have to then apply those to their individual situation. They don't have the same access to things like CT scans or intensive care units, so you have to present the material with a recognition that their actual working experience and their ability to do certain things is different. But it's the same list of topics, it's the same principles that go into it, it's the same approach with a child that's severely injured or seriously ill that you need to apply wherever you're working. So we brought in 35 physicians from around Yemen to the capital city, and had people from, 2 or 3 people from a number of different hospitals that we were able to do that course with. And that was very nice, because not only were we providing instruction, but it gave them a chance to talk amongst themselves and network and problem solve. We hope that by having these discussions, then when people return to their hospitals or go about their regular work, they've had a bit of background on it, so they have some of the language and vocabulary and concepts that allow them to say, here's the problem, here's the clinical solution, but there's also the practical aspect of how you make that happen, how you educate staff, how you maintain quality and look at your practice in a reflective fashion. Things that happen here on a very regular basis, to take an idea and make a plan and develop it and evaluate it. That happens so naturally here that we're able to really make tremendous strides so easily. Plus, of course, having the money and the resources in a province like Alberta makes it, it's very humbling when you go over to a country like Yemen and see exactly what people are doing to face the challenges that they face on a day-to-day basis. We go there just for short 2 or 3 week trips, and these are people that are working on a day-to-day basis to try and provide health care to very sick and very injured children. In other locations, we've done small group teaching, lectures to medical students, to nursing students, to midwife students, and trying to find out what they really want to learn the most about. So we would go with a list of topics that we'd be able to lecture on or have seminars on, and then find out which ones were most applicable to their situation. As well, we would always bring in an aspect of healthcare administration. So it's not just this is the way you treat seizures, but also to bring in the question, how do you train your staff throughout your emergency department or in your hospital? How do you maintain their commitment to ongoing improvement? What equipment do you need to have, and how are you going to make sure that equipment is regularly checked? All those things that go into high quality care need to have a discussion, and I've found that the approach Bridges has, where we actually bring healthcare administrators over, has really allowed that discussion to be a very productive one.